It's Diabetes Week on ESPN with our panel. Sportscaster Joe Buck, former football player Wilford Brimley, St. Louis Rams running back Fashawn Smith, and award-winning endocrinologist Dr. Harold Pepper.
Welcome back to Diabetes Week. I'm Joe Buck, and this is a topic that is near and dear to all of our hearts because we are all affected by diabetes.
That's right, Joe. My wife Abigail is pregnant with our first child. She was just diagnosed with gestational diabetes. Now, this whole process has been strange. They made her drink a sugar syrup just to diagnose her.
Yeah, that was a form of an oral glucose tolerance test. It's a process where you have to drink a sugary drink, and a phlebotomist will take a sample of your blood after 2 hours to see the levels of the blood glucose. If your blood glucose levels are higher than 200 milligrams per deciliter, then you have diabetes. This is a common diagnostic tool that is used to diagnose all types of diabetes.
You know, I was actually diagnosed with type 1 diabetes as an adult. And that surprises many people because it's commonly known as adolescent diabetes because the majority of people are diagnosed in their adolescence. However, there is a small percentage of adults that are diagnosed with type 1 diabetes.
Well, I'd like to talk to everyone about how diabetes affected me. When I was first diagnosed, I was scared to death, and I had experienced symptoms that were strange and unfamiliar to me. For example, I had an unquenchable thirst, and my tongue felt like a horseshoe rasp. I was losing my vision, and I was losing my energy.
Well, Wilford, those symptoms are very common in diabetes. I believe Dr. Pepper has brought us a video that can clarify to the public on the different forms of diabetes. Is that right?
That is right. It's important for everyone, especially to the fans of the NFL, to know the dangers of eating large quantities of saturated fat and foods that are high in sugar. I believe that this video will shed some light on a lot of things. Let's watch.
Diabetes. Your grandfather has it, your neighbor had it, and even your cat has it. This disease seems to be everywhere, and it particularly is. As of 2012, approximately 9.3% of the American population has diabetes. What is this disease and why is it everywhere? There are three main types of diabetes, and they all pertain to the malfunction with the insulin within the body. Without the insulin production, blood glucose in the body cannot enter into the cells. Insulin binds to receptor sites and stimulates the opening of the cell for glucose to enter, causing the blood glucose levels to continue to rise throughout the body.
Type 1 diabetes is the least common form of diabetes and occurs when the pancreas fails to produce sufficient amounts of insulin due to the failure of beta cells, which were destroyed by the immune system. There are many other symptoms that may be associated with type 1 diabetes, including frequent urination, excessive thirst, slow healing flesh wounds, blurred vision, fatigue, and weight loss, the body's attempt to gain energy by burning fat sources. Type 1 diabetes cannot be prevented, but is treated with insulin injections in accordance to glucose consumption.
Type 2 diabetes is the most common form of diabetes. It accounts for approximately 90 to 95% of all cases. In type 2 diabetes, the body either isn't producing enough insulin or is producing insulin, but the insulin is not working properly. Overweight and obese individuals have a significantly increased risk for type 2 diabetes. Fat deposits may build up on the insulin, causing them to not allow blood glucose into the cells of the body, and the blood glucose level in the body would continue to rise. The symptoms for type 2 are virtually the same as type 1. The first line of defense for type 2 diabetes is nutrition therapy, but medication is most likely used in type 2 diabetes because it is considered to be a progressive disorder.
Body composition is also significant to the development of type 2 diabetes. According to a study in the Diabetes Care Journals, visceral adiposity is causally related to insulin resistance. Visceral fat is metabolically different than subcutaneous fat and increases the risk of insulin resistance. Men gain weight as visceral fat in their abdomen and therefore have an increased probability of getting type 2 diabetes.
The third form of diabetes is known as gestational diabetes, and it may be developed in females during pregnancy. The exact cause of gestational diabetes is not quite clear, and further research is required. However, it is believed that the placenta around the fetus may release hormones that prevent the body's production of insulin, causing an elevation in blood glucose levels. Gestational diabetes may result in birthing complications such as high blood pressure, premature birth, or cesarean birth. It may also cause complications for the newborn, including excessive birth weight, low blood sugar, jaundice, or difficulty breathing. Gestational diabetes usually goes away after the birth of the child. Treatment revolves around maintaining a normal target range for blood glucose levels by following a healthy diet that is endorsed by a physician, performing regular exercise, and checking blood glucose levels on a regular basis.
All forms of diabetes may be treated through diet, exercise, and/or medication. In type 1 diabetes, a person may lead a normal life by following a healthy eating plan, perform adequate exercise, and take the proper doses of insulin through injection. All diabetics should stop smoking due to their increased risk for cardiovascular disease in diabetics and should monitor their blood pressure, cholesterol, and blood glucose levels on a regular basis. Nutrition therapy is still considered the first-line therapy of choice for the treatment of type 2 diabetes. Dietary programs are patient-specific, and the food intake pattern should be assessed for appropriate restrictions towards saturated fat, cholesterol, sodium, and sugar intake.
While it is not fully a form of diabetes, prediabetes is an important topic to discuss. Prediabetes is when blood glucose levels are higher than normal and can lead to type 2 diabetes. This is often seen as a wake-up call to patients in order to improve their health. This disorder is very common and approximately 3 million cases are reported each year. Prediabetes can be reversed, but type 2 cannot.
There are terrible consequences for people who do not manage their diabetes properly. High blood glucose levels can draw out water from tissues and cause damage to the eyes and can stop cuts from healing. Many patients with diabetes have lost appendages due to infection of unhealed sores. If you are diagnosed with diabetes, management is absolutely necessary.
I want to reiterate that type 2 diabetes can be prevented. According to a 2010 study in Diabetes Care, drinking 1 to 2 sugary drinks per day increased the risk of type 2 diabetes by 26%, compared with having less than 1 serving a month. Lastly, it's important to know that while diabetes is treatable and preventable, it's also very deadly. Diabetes is the 7th most common cause of death in the U.S. and is often shown to lead to heart disease, the #1 most common death in the United States.
Hopefully with the help of ESPN, you can prevent type 2 diabetes, or learn to manage your diabetes. In closing, I would simply like to say to you, do the best you can with what you got. And be thankful that you are in no worse shape than you are. If you listen to our treatment techniques, I promise you that you will feel better. See if I'm not right. Thanks for your time. Have a good day.